Hi T, thank you for agreeing to do the video. It's going to help other patients and other physicians as well. You did your first Sculptra in June, that was 5 months ago.
Correct.
So tell me, how was the experience?
The experience was good. It was less painful than I expected, and downtime was very minimal. I was able to return to work the next day, and it wasn't a big deal at all.
Okay. And the change that you saw afterwards, how would you describe the change?
Amazing. I felt, in a couple weeks, I felt 10 years younger, and immediately I felt 5 years younger.
Okay, that's very good, that's excellent. So today we'll be doing the second session of Sculptra. And you already applied the numbing cream today?
Yes.
Okay, very good. And you have not taken any aspirin, Motrin, Excedrin?
No.
Any fish oil?
No.
No, okay, because those are the main culprits that can make you bruise a lot. So wonderful, so that's what we'll do. And so usually what I do is I have my Sculptra ready in advance. It comes in, let's see if the camera can catch it, in a bottle, and it usually is just a little powder. And I fill it up with 10 cc total volume. In the beginning we used to do about maybe 4, then 6. Now we use up to 10 cc's of water in it. But usually I have a combination of 6 cc's of bacteriostatic water, so bacteria don't grow in here, and 4 cc of lidocaine, the numbing medicine, 2% plain. And I usually mix it the day it comes in from shipping and just leave it on room temperature, and I leave it there. And when we're ready to use it the day, we just shake it for a few minutes. We just shake it for a few minutes and then mix it up very nice. And then it's ready to go. When we are filling it up in here, as you can see probably, that it's filled all the way to the top. So it's very important to fill it carefully so it doesn't, start getting pressurized inside and just spurts out completely. That can make it a little tricky. So it's important to be very careful doing that. But now it's ready and it's pretty homogeneous. There are no granules, and the foam on the top is the cellulose, which is inactive ingredient, so that's not the material. So sometimes if you feel like you need to get that foam, you don't. It'll only clog your needle. It is not going to help you or the patient. So with 10 cc's, now I know what I have to work with, and then I start with marking the patient as to where I will inject and how much. In my opinion, the part of marking and assessing the face is the single most important thing to do. And as you had mentioned, your concern was looking tired. And I think it happens because, I'm going to have you turn a little towards the camera, because our face and all the tissues, they start going from here when we're younger, sagging downwards like this. That's what happens to all of us. And in your case, and everybody else as well, I try to recreate what they had 20 years ago. And looking at old pictures or looking at models' pictures is very helpful. So in your case, when I'm looking at here on the face, what I see is that upper 1/3 of the horizontal face is beautiful. Middle 1/3 shows 2 areas of deficiency. One is the tear trough or the nasojugal groove, and then the prominence of the cheek, the malar eminence. Because if that was filled, that would lift up everything a little bit and make the face more youthful. As we come downwards, in the horizontal lower 1/3 again, I found the angle of the jaw, the mandible, to be a little deficient. If it was a little bit more square, that would make the face more harmonious. Keeping that in mind, I'm going to do my markings. This is a white eyeliner, and it comes off very easily, it doesn't hurt, and it's great to work with. I'm going to be using 5 cc's on this side and 5 on the other, so I'm marking as 3 cc's here and 2 cc's on this side. I'll be doing the same marking on the other side as well. Three and two. So that's on the left side. 3 cc's in the cheek and the nasojugal groove area, and 2 along the angle of the jaw. And it's the same on the other side as well. 3 and 2. And that makes a total of 10 cc. I always inject a little less than that because there's always a little bit of wastage, so you don't want to run short on one side. So I would inject probably like 2.5, 2.75 on each side in the cheek, and maybe 1.5 each side around the mandible to make sure there's equal distribution. Okay, T, we will be starting the injection soon. For my injections, I use a 3 cc syringe with a needle to draw. It's a 21 gauge needle on it, and then I use 25 gauge needle, 1.5 inch long for injecting. And I have an assistant right behind you. One of the things that's very crucial with Sculptra injections is to have someone apply immediate pressure after injection, and that stops the bruising or minimizes it. And that's very helpful, and I will demonstrate that as we go along. One of the reasons I wanted to make this video is because a lot of people, a lot of patients are very afraid. They think it's really going to hurt, and it's like a brutal thing, but
It's not.
It's not, but the thing is, seeing is believing.
Mm-hmm.
Once you've seen something, then you can say, okay, I believe it, I can handle this. And it truly is a no downtime procedure for most people, as long as, they follow the directions really well. And one of the things that I found very helpful is having some of the patients take a small dose of Xanax, 0.25 milligram before they come, which seems to take the edge off.
Mm-hmm.
And once you don't have that little anxiety related to the procedure, your blood pressure goes down. It really does. And then you have less chance of bruising. There's no doubt about that.